What are kidneys? Every person has two kidneys. They are bean-shaped organs and each measures about the size of a fist. Kidneys are located in the middle of the back, on the left and right sides of the spine, just below the rib cage. Each kidney leads to a tube called ureter which drains the urine into the urinary bladder. Each kidney has a million working parts called nephrons which have a filtering unit called glomerulus. How do kidneys work? The main function of kidney is to filter extra water and wastes out of your blood and make urine. The waste products include urea, uric acid, creatinine, ammonia, sulfates etc. 800 milliliters to 1 liter of urine is produced by the kidneys per day on consumption of 2 liters of water. Urine volume depends on intensity of work, water and fluid intake and environmental conditions apart from other factors. They also help control blood pressure, make hormones that the body needs to stay healthy and maintain chemical balance and composition of body fluids. The kidneys also indirectly stimulate production of red blood cells. What is chronic kidney disease or CKD? Chronic kidney disease, which is abbreviated as CKD, means that the kidneys are damaged and can't filter blood normally. It develops slowly and the number of functioning nephrons gradually decreases. This damage leads to buildup of wastes in the body. It often worsens over a period of time. If not treated, it can lead to kidney failure. This means the kidneys have stopped working totally. If the kidneys fail, dialysis or a kidney transplant is required to maintain health. What causes chronic kidney disease? Diabetes and high blood pressure are the most common causes of CKD. Other causes include heart disease, kidney infections, stones, injuries, degenerative changes and cysts. Family history of kidney disease, that is if mother, father, sister or brother had kidney disease or kidney failure. What are the symptoms of chronic kidney disease? Early kidney disease has no signs or symptoms. This means that the individual doesn't feel any problems. Symptoms usually develop when serious damage to the kidneys has been done. Persons with CKD may have nausea, weakness, lethargy, headache, swelling over the face and body and in severe cases convulsions and coma. What tests help track chronic kidney disease? Blood and urine tests are used to check for CKD and also for monitoring progress. Regular blood pressure and blood sugar checkup for hypertension and diabetes should be done. How does chronic kidney disease affect health in other ways? People with CKD often develop high blood pressure. They can also develop anemia, bone disease, malnutrition, and heart and blood vessel diseases. Is change in diet required in CKD? Yes, diet management is a very important part of treatment of CKD. Kidneys help to keep the right balance of nutrients and minerals in the body. But due to kidney disease, the kidneys may not be able to do this function very well and hence changes in the diet are required. Changes in the diet also help to control diabetes and blood pressure better and prevent kidney disease from getting worse. What kinds of changes to the diet are required? There is not one eating plan that is right for everyone with kidney disease. What one can or cannot eat may change over time, depending on kidney function and other factors. People with kidney disease will need to control the amount of protein, sodium, potassium, phosphorus, and calcium in their diet. Why is good nutrition important for people with kidney disease? Good nutrition can help to provide energy to do your daily tasks, prevent infection, and loss of muscle mass. It also helps to maintain a healthy weight and slow down the progression of kidney disease. A well-balanced diet provides the right amounts of protein, carbohydrates, fats, vitamins and minerals. Eating a balanced diet, staying physically active and taking medicines on time as prescribed are all important. What are proteins? Body needs protein to help build and repair muscles, organs, tissues and fight infection. Protein can be found in foods from animal and plant sources. Most diets should include both types of proteins. Animal proteins include meats like mutton, chicken and fish, eggs and dairy products like milk, curd, cheese and cottage cheese. Plant foods which provide proteins are beans, peas and lentils, soy foods such as soy milk and tofu, nuts and seeds and cereals. Why are proteins important in CKD? When your body uses protein, it produces waste. This waste is removed by the kidneys. Too much protein can cause waste to build up in your blood and make the kidneys work harder. So people with CKD may need to eat less protein, which may help the kidneys work longer. However, protein intake should not be too low, or it may cause other problems. What is the right amount of protein in CKD? Doctors will recommend how much protein to eat each day based on weight, stage of kidney disease, level of nutrition, muscle mass and other things. A normal individual needs 1 gram per kilogram of body weight of proteins every day. However, a CKD patient will need slightly lesser amount. It may vary from 0.6 to 0.8 gram per kilogram of body weight per day depending on the nutritional status and stage of the disease. Half of the protein requirement has to be fulfilled from high biological value so that the patient does not lose muscle and does not build up more kidney waste. What are calories? Calories act like fuel and provide the body with the energy to perform its functions. Why are calories important? They help the body to use the protein in food to build muscles and tissues. Without enough calories, body will waste proteins to provide you with energy instead of using protein to build your muscles and tissues. It is important to plan meals that give enough calories each day or else the body may not have energy to stay healthy. How many calories are required in chronic kidney disease? Calorie requirement is based on ideal body weight of the patient. A healthy diet for CKD should provide 35 kilocalories per kilogram per day. Patients 60 years and older tend to be more sedentary. Thus a diet providing 30 to 35 kilocalories per kilogram per day is also acceptable. What are carbohydrates? Carbohydrates are the primary source of energy or calories for the body. Carbohydrates are commonly found in grains or cereals and root vegetables. CKD patients should prefer low phosphorus carbohydrates such as rice, semolina, vermicelli, sago, etc. Root vegetables such as potatoes and sweet potatoes also add carbohydrates, but due to their high potassium content they need to be leached before eating. Sugar is a readily available source of carbohydrate. What are fats? Fats provide almost double the calories for the same amount of carbohydrate or protein ingested, thus they are more dense or high-calorie energy sources. Unsaturated fats found in fish, nuts and vegetable oils such as groundnut oil, mustard oil, sunflower oil, safflower oil, olive oil, rice bran oil are healthier as compared to saturated fat which is present in butter or ghee, red meat, poultry, pork and cheese. Ratio has to be maintained for both in the diet. What is sodium? Sodium is a mineral found in most foods. It is also found in table salt. Sodium affects blood pressure and water balance in the body. Healthy kidneys can control sodium. But, if the kidneys do not work well, sodium and fluid build up in the body. This can cause high blood pressure and other problems like swelling of ankles, fingers or eyes. An individual will need to limit sodium in diet. Why is low sodium diet important? Eating less sodium helps lower blood pressure and may slow down progression of CKD. Patients should try to keep their blood pressure below 140 by 90 millimeters of mercury at all times. How much sodium should a patient eat every day? Most people need to eat less sodium than they are eating normally. Aim for less than 2000 milligrams of sodium each day or less than 5 grams of salt per day. How can CKD patients lower the sodium in diet? Buy fresh foods and cook them at home. Avoid packaged food like chips, wafers and snacks. ready-to-eat meals and noodles, canned or frozen foods, fast food and restaurant food, processed cheese, salted butter and processed meats because they are high in salt content, as additional salt is added to increase the shelf life of these foods. Also avoid food items high in salt like pickles, sauces and chutneys, and salted snacks and nuts. Do not use extra salt while eating an already prepared meal, and also in salads, curd and buttermilk. Check the ingredient label for added sodium like salt, which has sodium chloride, monosodium glutamate or MSG, baking soda or sodium bicarbonate, and baking powder used in bakery products, sodium malganate used in ice creams, sodium benzoate used as preservative in sauces, sodium citrate used as a flavoring agent, sodium nitrate, sodium S-sulfite, sodium phosphate, sodium hydroxide, sodium propionate, etc. Do not use salt substitutes unless approved by the doctor, as they may contain potassium, which can in turn raise potassium levels in CKD patients. Try fresh or dried herbs and spices like mint, cumin, curry leaves, coriander, cardamom, cinnamon, oregano, thyme, basil, etc. instead of table salt to bring out the flavor of foods. When you limit salt, you may have to use more herbs and spices to get more flavor. Also, try adding a dash of pepper or a squeeze of lemon juice for flavor and added vitamin C. What is phosphorus? Phosphorus is a mineral that helps keep your bones healthy. It also helps to keep blood vessels and muscles working. Phosphorus is found naturally in foods rich in protein, such as meat, poultry, fish, nuts, beans and dairy products. Phosphorus is also added to many processed foods. Why is phosphorus important for people with CKD? In CKD patients, phosphorus can build up in the blood, which causes blood calcium levels to drop, and calcium is pulled from the bones, making the bones thin, weak, and more likely to break. A high level of phosphorus in your blood may also cause calcium to build up in your blood vessels, heart, joints, muscles, and skin, where it does not belong. This may cause serious problems such as damage to the heart and other organs, poor blood circulation, bone and joint pain, itchy skin and skin ulcers. Eating high phosphorus foods can raise the level of phosphorus in your blood, and the kidneys may not be able to remove all of this extra phosphorus. How to lower phosphorus in diet? To keep phosphorus at safe levels in your blood, you may need to limit phosphorus-rich foods. Large amounts of phosphorus are found in dairy products such as milk, cheese, paneer, yogurt and nuts, beans and peas such as kidney beans, split pea and lentils, and meat products. Eat a calculated amount of these foods for optimum protein and phosphorus intake. Consult a renal nutritionist for the same. Natural food sources have phosphorus in bound form, which does not become available fully to the body. Whereas pure and dark cola drinks, ice cream, processed, convenience, and fast foods like biscuits, chocolates, burgers, rolls and some meats that have additives to make them tender etc. have phosphorus in a form which is readily available to the body. Therefore, all these foods must be avoided. Many packaged foods have added phosphorus. Look for phosphorus or for words with phos on ingredient labels. Choose a different food when the ingredient list has phos on the label. Amount of phosphorus in daily diet of a CKD patient should be less than 1000 mg, which may vary with the biochemical parameters of the patient. What is potassium? Potassium helps the muscles and heart work properly. Too much or too little potassium in the blood can be very dangerous. How much potassium is needed depends on how well the kidneys are working. It also depends on any medicine that can change the level of potassium in the blood. How do I know my potassium is high? People often do not feel any different when their potassium level is high. The doctor can check the potassium levels by a simple blood test. How do I lower potassium in my diet? Salt substitutes often contain potassium and should not be used. Even salt packets available as low-NA or low-sodium salt are rich in potassium. Eat smaller portions of foods high in protein like meat, poultry, fish, beans, dairy and nuts. They are high in potassium. Choose fruits and vegetables that are lower in potassium. Almost all fruits are rich in potassium except a few ones like peeled apples and pears, but portion size of low potassium fruit also has to be watched. Medium and high potassium fruits may also be included in diet after calculating the portion size and overall potassium content of the diet. Fruit juices should not be a part of diet of CKD patients as these are concentrated source of potassium and should be totally avoided. Almost all summer vegetables like bottle gourd, round gourd, ridge gourd and pointed gourd are low in potassium content. Other vegetables can be added in diet after peeling, cutting and soaking in warm water for an hour and discarding the water. High potassium vegetables like cauliflower need to be cut and boiled and after discarding water can be added periodically in diet by judicious calculation. Potatoes need to be cut in 4 and boiled before consuming to leach out most of the potassium in them. Remember, a low potassium food will become high potassium if taken in huge quantity. What is the reason for swelling of my arms and legs and puffiness around my eyes? The kidneys have an important function of maintaining the right amount of water in the body and removing excess as urine. In CKD patients, as the kidney function worsens, the amount of water removed from the body as urine decreases, leading to water retention or edema, which shows as puffiness around the eyes and swelling of arms and legs. What can I do to reduce this swelling or edema? Swelling or edema depends on the water or fluid intake of the person. Patients should record their weight daily to monitor fluid volume in the body and detect any fluid gain or loss. It is important to understand that fluid intake does not refer to water intake only but also includes drinks like tea, coffee, milk, soup, cold drink, ice cream and consumption of foods with high water content like watermelon, grapes, lettuce and tomato etc. How much water or fluid am I allowed to have? The volume of fluid permitted varies for every CKD patient depending on his/her clinical status, kidney function and urine output. Patients should consult their doctor for advice on fluid restriction and follow it strictly. For example, if urine output is 500 milliliters, so by rule it will be 1 liter of fluid per day, that is, urine output plus 500 milliliters. Take a 1 liter bottle and fill it with water. Use this water for drinking, making beverages like tea, coffee, etc. and for cooking, to be accurate in your fluid intake per day. How do I know if I am monitoring my fluid intake correctly? Body weight remains constant when fluid intake is proper as per recommendations and is followed strictly every day. Weight gain may be a warning sign for fluid overload in the body due to increased fluid intake. How can I reduce my fluid intake? Fluid restriction requires strong willpower and commitment along with daily monitoring of fluid intake and urine output. Here are some practical tips to help you. Measure your weight at the same time every day to monitor it correctly. Calculate the permitted amount of fluid for the day daily according to the doctor's advice. Keep in mind that fluid also includes intake of tea, coffee, milk, soup, cold drink, ice cream and foods with high water content like watermelon, grapes, lettuce, tomato, and vegetable gravy apart from the water intake. Always use the same sized cup or glass for all the fluids you consume in a day so that you can keep a better track of the fluid intake. Avoid eating spicy and fried foods as they can make you thirsty. Have only a small quantity of water when thirsty. You can also suck ice as it stays for a longer time in the mouth, but do not forget to take into consideration the amount of water frozen to make ice. Avoid taking extra water with medicines. It is best to take the medicines after meals when you are already going to have some water. In case of dry mouth, try gargling water without drinking it to moisten the mouth. You can keep an ice cube on lips and rub it for feel-good factor. Also, sucking hard candy, mint or lemon can help reduce dryness. Keep yourself busy with work or activities such as reading, watching television, listening to music, writing, meditation, etc., because the urge to drink water might increase when you are idle. Avoid going out during morning or afternoon in hot summer months. It is better to go out when the weather is slightly cooler to prevent dehydration. What else is required for maintaining adequate nutritional status in CKD? Diet with high fiber content is beneficial, thus vegetables and fruits such as apple, pear, beans, bottle gourd and onions which have low potassium yet good fiber content should be eaten regularly. There may be an inadequate intake of vitamins and minerals due to poor appetite and dietary restrictions of many fruits and vegetables in CKD patients, hence supplements of iron, folic acid and vitamins may be taken as recommended by the doctor. What is dialysis? Dialysis is the process of removing excess urea, fluid, electrolytes, minerals, and other wastes from the body when the kidneys are not functioning properly. However, other functions of the kidneys like production of erythropoietin hormone cannot be replaced by dialysis. When does a CKD patient require dialysis? When the kidneys lose most of their function and medical treatment does not suffice, the waste products and excess water starts to build up in the body. The CKD patient then reaches to the stage of end-stage kidney disease and would require dialysis. What is the importance of diet for people receiving dialysis? To prevent the buildup of waste products and water in the body between dialysis treatments, the intake of fluids and certain foods must be limited. If the patient doesn't get enough calories every day, the body will break down muscle for energy or calories over time, resulting in weight loss. People starting dialysis may previously have been on a low-protein diet. With dialysis, the body needs more high-quality protein. Individuals are asked to restrict their fluid intake to prevent excess water buildup in the body. Levels of sodium, potassium, phosphorus and other elements need to be maintained according to their blood levels by appropriate dietary measures. Dialysis adequacy must be monitored by observing the patient's biochemical parameters, fluid retention and appetite improvement, and quality of dialysis needs to be checked before proceeding with any further treatment plans. Other lifestyle changes which help in improving quality of life in chronic kidney disease patients are meditation and exercise. What is meditation? Meditation can be defined as a practice where an individual uses a technique, such as focusing their mind on a particular object, thought or activity to achieve a mentally clear and emotionally calm state. Meditation helps in reducing stress, anxiety, depression and pain. It increases peace, perception and well-being. Role of meditation in chronic kidney disease. Meditation has a favorable role in improving blood pressure, kidney function and works at physical and psychological levels to improve the quality of life in patients with CKD. What are the various forms of meditation? There are different forms of meditation. One such method is mindfulness meditation. Mindfulness meditation involves the process of developing the skill of bringing one's attention to whatever is happening at the present moment. Practice relaxation breathing for 1 minute. Close your eyes and take a deep breath for a count of 4, and then exhale for a count of 8. As you inhale, visualize the movement of oxygen through your respiratory system. As you exhale, imagine stress float away with it. Repeat 5 times. You can also perform mindful breathing meditation for 7 minutes. Sit comfortably with a straight back. Begin counting your inhalations and exhalations from 1 to 10, like inhale 1, exhale 1, inhale 2, exhale 2 and so on. When you reach 10, start again but count backwards to 1. Repeat this cycle 5 times. When you've completed 5 cycles of breath counting, simply continue to breathe at this calm, steady pace for 2 to 3 minutes. Visualizing the breath moving through the respiratory system and appreciating its physical relationship with the body. Body scan meditation for 5 minutes will relax your whole body. Sit or lay down in a comfortable position and take a few moments to find a calm, steady breath. Now, bring your awareness to sensations in the body, where you will spend several slow breaths on each focal point, beginning with the left toes and checking in with left foot, left ankle, calf, knee, thigh, all the way through the left hip. When you notice an area of tension or discomfort, breathe into it, relaxing on the out-breath. Repeat through the right side. Follow with the pelvic region, abdomen and lower back, moving up through the torso and heart region. From there, follow and breathe through the sensations in the fingers, hands, wrists, up the arms, through the shoulders, neck, jaw, temples, ears, eyes, forehead, crown of the head and skull. Why should patients with CKD exercise? People with chronic kidney disease can benefit from exercising regularly, just like those without this condition. Exercise reduces stress, anxiety and depression, leaving individual feeling revitalized and relaxed. Health can improve by engaging in activities that strengthen the muscles, bones, and joints in the body, keeping the patient strong and help maintain the ability to carry out everyday activities. As the patient becomes fitter, he or she can do more with less effort, helping them remain independent and have a better quality of life. Physical activity helps to manage blood pressure, diabetes and cholesterol, makes the heart more efficient and improves the health of blood vessels, reducing the risk of heart disease. What types of exercises can CKD patients do? CKD patients can do aerobic, strength and flexibility activities. Aerobic activities are those in which the body uses large amounts of oxygen. These types of exercises include walking, jogging, stair climbing, swimming, gardening, dancing, cycling and chair exercises. Other types of aerobic exercises can be performed on machines such as a treadmill, stationary bike or elliptical trainer. Strength training involves using large muscles of your body to perform activities. For instance, free weights or dumbbells aid in strengthening your muscles. Flexibility enhancing activities move your joints through their full range of motion and help to lessen your risk of injury when performing physical activities. These include stretching and yoga. How much should one exercise? If the patient has not been exercising regularly, it is advisable to start slowly and work up to a comfortable pace. Ideally engage in exercise, aerobic, strengthening or flexibility activities 5 times per week. It is recommended to get in the habit of exercising at the same time each day so that it is less of a chore and more of a routine of living healthy, just like eating meals. Begin and end the workout with stretching exercises and follow with either an aerobic activity such as walking or strength training such as lifting handheld weights. A combination of these activities using different muscle groups each day, such as the upper body one day and the lower body on another, will improve your health over time. How to stay safe while exercising? Listen to your body when exercising. A little exercise regularly is healthier than not exercising at all. If you develop any of the following problems, that is warning signs, stop what you are doing and seek medical help. Muscle cramps or joint pains, nausea or vomiting, pain in the upper part of your body including your face and jaw, problems seeing, speaking or trouble swallowing, abnormal shortness of breath, sudden headache, dizziness or a feeling of lightheadedness, sudden weakness in your arms or legs. You should not exercise if you have chest pain or you have suffered a cardiac event in the last 6 weeks. You are short of breath at rest and you have visible swelling from fluid overload. You have an acute infection or fever. You have poor diabetes or blood pressure control. Start with an aerobic walking program. Begin by walking at a slow but steady pace for 10 minutes, 5 days a week. Once comfortable with the walking 10 minutes daily, increase to 20 minutes every other day at a brisk pace. At 1 month, increase your time to 30 minutes every other day. After 1 month, Walk for 30 minutes, 5 times a week. An easy strength-building exercise is toe raises. Stand straight with your hands on a counter or rail for support. Slowly raise your heels up off the floor and count to 2. Then lower your heels back down to the floor. Repeat 8 to 12 times. Another muscle strength-building exercise is leg lifts. Sit on a chair where your back is straight and your knees are bent and feet are flat on the floor. Lift and straighten your right leg and hold for a few seconds. Lower your right leg to the starting position. Repeat using your left leg. Perform exercise 8 to 12 times with each leg. Flexibility exercise includes stretching, which will help to strengthen and loosen muscles and joints. Perform these as a warm-up and cool-down part of your overall exercise plan. An example is shoulder rotations. While standing or sitting, move the top of your right shoulder forward in a circular motion for 15 to 30 seconds. Repeat with your left shoulder. Leg stretches are another example of stretching or flexibility exercise. While lying on your back, bend your right leg and keep your left leg straight. With both your hands placed behind your right leg, pull your thigh toward your chest and hold for 15 to 30 seconds. Repeat with your left leg. We hope that the information provided is helpful to improve the nutritional status and quality of life of chronic kidney disease patients.